IVF patients understand the importance of being well informed. After all, they're smart. They know that the more the information they have, the better for them. Which is why they go to the doctor and they expect the doctor to provide them with this information. But you know how doctors are extremely busy, not enough time, running around from patient to patient, from clinic to clinic, maybe 5 minutes to spare. They allow the assistant or the junior or the nurse to do all the talking. So they really don't have the time or the energy or the inclination to talk to patients. So then patients are forced to go to the internet to look for information. They go to Dr. Google. What you need to remember is Google itself doesn't provide any information. Google guides you to various sites which will provide information. And this is what the big problem is. Because patients aren't sophisticated enough to understand the difference between a good site and a bad site. And a lot of the sites which Google directs you to are commercial sites. Do you know why? Because these are commercial sites. They make money from the website, so they pay Google to run ads. And Google is, after all, a business. They will run the first ads first before the good sites. As a result of which, patients will usually go to these commercial websites, either run by IVF clinics or by someone who's selling them some hocus pocus and promising to use this medicine to magically improve their sperm count or use this medicine to improve their ovarian reserve or some kind of rubbish. And because patients are ignorant, gullible, vulnerable, it's very easy to take them for a ride and they get taken for a ride. This doesn't mean that you don't use the internet. It means that you learn to use the internet intelligently. You are smart. What you need to do is, instead of directly going to Google, learn to go to reliable medical websites, Mayo Clinic, Harvard, Hopkins, or the government of US or the government of UK websites. These will provide you with reliable, trustworthy information because they don't have anything to sell to you. Read at least 2 or 3 websites which are independent, which will provide you with non-commercial, accurate, reliable, updated information. So you then you have enough of a basis, a sound understanding. And once your understanding is sound, then you can explore other sites. And then you can learn to ask your doctor intelligent questions. A lot of doctors get pissed off when patients ask them questions based on their Google search. But if a doctor gets upset when you ask questions, that's a bad doctor. It's a doctor's job to reduce your anxiety levels by educating you. And good doctors will do this through their own website rather than expecting you to search for the information for yourself.